Hello and good morning, everyone. Thank you for joining us today. My name is Jessica Zavala, and I have the pleasure of welcoming you on behalf of the Ohio Program for Campus Safety and Mental Health to today's webinar, Beyond Telehealth, Use, Evidence, and Informed Decision-Making Around Smartphone Apps for College Mental Health. Today, we are joined by two experts in the field of digital psychiatry in relation to smartphone mental health apps. And I'm excited to welcome them and to hear more from them, Dr. John Torous and Jennifer Melcher. John Torous is a psychiatrist at Beth Israel Deaconess Medical Center, a Harvard Medical School affiliated teaching hospital where he is assistant professor and directs the Division of Digital Psychiatry. Jennifer Melcher is the Director of College Mental Health Research in the Division of Digital Psychiatry and leads ongoing studies using technology to increase access and quality of care. Together, they have published 4 papers on smartphones and college mental health in the last year and collaborate around new care models for safely integrating digital technology into student care. So without further ado, I'd like to welcome Dr. John Torous and Jennifer Melcher.
Thank you so much for having us and inviting. It's an honor to be here. We have a lot of exciting things to share with you about smartphone apps and digital health and college mental health. We'll aim to leave time at the end for questions and put our contact information because we realize some of this can be very specific to your school or your need, but hopefully we can cover the space pretty broadly. So we're going to talk about, again, beyond telehealth, the use, evidence, and informed decision-making around smartphone apps for college mental health. We realize that the digital health space is rapidly evolving. There's a lot of different technologies and tools that are being researched and used and that you may have seen, your students may be asking you about, you may be interested in. They range from things you can imagine, smart homes or smart campuses, to video games, to virtual reality. We're not going to talk about telehealth. We assume that everyone here has likely had some telehealth experience in the last year, whether you wanted to or not. We also won't talk about tablets as much. We're really going to focus on smartphones, a little bit on wearables, but the reason that we think smartphones are an exciting device to follow, to kind of talk about around college mental health, is really about their accessibility. I think if you reflect on the people that you work with and serve, it's probably unlikely that someone who is a college-age youth does not have a smartphone. It's certainly possible not everyone has equal access. We're well aware that there is still a digital divide. But if we actually look at data that's actually 2 years old, that's kind of national data across the US, it's interesting. We can look at kind of the trends in connecting people to the internet. And you can see on the left panel, we're getting better at connecting everyone to care. And if you look at who wasn't online, even in 2019, there are differences for people who are older, for minorities, for people in rural areas with less education, it's going to be lower. But if you look at it and say, well, the college population, there's very few people that don't have internet or technology access. If you look at the age, 18 to 29, it was 0% were not online. So we realize that there will be certain schools, certain regions, certain populations that may not have ideal access. But we think, and at least what we've seen with different students and groups that we work with across the country, is that increasingly people will have access. And if they don't have access today, there's actually a program called the FCC has Project Lifeline, I believe it's called, where you can actually help students who can't afford a phone, who may be below the poverty line, actually qualify for a free smartphone or a very low-cost smartphone that actually has a lot of capabilities today. So there increasingly should really be no reason that someone isn't connected via phone. And if you're saying, well, John and Jenny, why are we talking about phones and mental health? This is an interesting paper that came out. The data was actually collected just before the COVID pandemic became more serious. The data was collected in December of 2019, and it was a very interesting study led by Emily Leahy in Chicago at CBITS, the Center for Behavioral Intervention Technologies at Northwestern. And what they did is they surveyed about 200 youth in the Chicago area and said, for mental health problems, what do you turn to, or what are you using? And you can see that most people are turning to or want to talk to a mental health professional. But if you look, apps were really 31.7%. People are saying, I'm going to look and turn to apps. Primary care was actually a little bit less at 36%. Self-help books were lower at 25%. Peer counselors were a little bit lower. Online communities were very similar to mobile apps, and other was there. What's interesting about this paper and data was that people said, I'm willing to use apps, I'm interested in them, but very few actually want apps to be the only source of care. They want to use apps as a way to augment and boost and extend care. They didn't want to be treated only by an app. They didn't want to say, I have to use an app first. They wanted to still see a person and work with a person. But you can see it's pretty impressive if before COVID, we had, again, almost a third of students saying, hey, I'm looking to apps, or they can be part of my mental health care. And again, we know in the last year, we've seen a lot more uptake, acceptance, and interest in different digital technologies. So certainly we'll talk more about COVID and how it's kind of pushed people towards looking at technologies. I'm sure all of your campus services have been impacted. But again, we have pretty good data that this is a trend that's, again, even before the pandemic.
And so at the same time that interest in mental health apps is growing, the marketplace of mental health apps is really booming. There's estimated to be around 10,000 mental health apps available between the app marketplaces like, the Apple App Store and the Google Play Store. So it's also a really dynamic, marketplace. It's always changing. One study showed that a depression app or some relevant depression app goes off the app marketplace every 2.9 days. So you can imagine it would be really hard to suggest a good relevant app considering the space is always changing. So I want to talk a little bit about why this is worth diving into for college students and why it's still important to sort through this mess for college mental health. So in the past few years, the need for services on college campuses has really increased. More and more students every year are being diagnosed with mental health conditions, and more students are seeking mental health services at their college counseling center, while there hasn't been kind of a corresponding increase in staffing or sort of services being offered at these college mental health centers. So often what this leads to is long wait times for appointments or reduced services for each student, like appointment limits. Some students can only get, 3 on-campus appointments before they have to seek help somewhere else. So there's potential there for apps to kind of fill in the gaps. And while, like John said, it wouldn't replace a face-to-face counselor, it might kind of provide some relief for students in the meantime during these waitlist periods, and at least, add some service that students can access immediately. Additionally, students are kind of a prime population to adopt mental health apps, given that so many of them do have smartphones. Pew Research Center data from actually 2021 showed that 96% of US adults between ages 18 to 29 do own a smartphone. And that's really the prime college age range. So this, need for services has also only increased during COVID as mental health among students has worsened. A survey of about 2,000 students in the spring of 2020, so peak coronavirus anxiety time, showed that almost 50% of students are experiencing depression. Almost 40% are experiencing some level of anxiety, and there's a huge amount of students having suicidal ideation. So this is a really serious problem, and at the same time, students are remote. They may not have the same access to their counseling center that they did when they were on campus, and they really need services immediately. So we asked 100 college students whether they would feel comfortable using mental health apps and, to see really whether that would be a good solution for them. And what we found was many students are comfortable with a lot of features of mental health apps, mostly like coaching for healthy living and mindfulness meditation interventions, although they feel less comfortable with, apps that would perhaps ask them to share their data, like their social information and their location. All in all, what this told us is that students are interested in using mental health apps, and there is the potential for it to be a good resource for them. So after this, we did an analysis of 60 college counseling centers, and we looked on their websites. We wrote down any app we found that they were either suggesting or offering to students to use, and this revealed a total of 218 unique mental health apps that counseling centers were suggesting to their students. However, once we started looking into these, we found that over a quarter of them were actually removed from the app marketplace, which means even though it's on the counseling center website, a student couldn't go onto the App Store or the Google Play Store and find that app. So this kind of takes us back to that same, this marketplace is really dynamic and changing all the time, and it can be really difficult for a counseling center to try to suggest good apps. Further, when we looked into these existing apps, many of them were out of date. Research shows that generally an update within the past 6 months means apps are kept up to date. You know, the developer is still working on them. They likely still have up to date and accurate information. Whereas if apps are updated, you know, more than 6 months ago, it goes to show that perhaps they've been abandoned by the developer. The information might not be as accurate, and the app might be potentially harmful if it's offering inaccurate information to the user. So over 50% of the apps that we looked at that were still existing had been updated, hadn't had an update in the past year. Additionally, of the 158 existing apps that were suggested to students, only 61% had a privacy policy. And what that means is that only 61% of these apps are even disclosing what they're going to do with the student's data. Because it's a mental health app, it's likely that students are, you know, inputting more sensitive data, something that they might not want shared. When we looked at the apps that were existing, 30% of them admitted to disclosing user data to third parties. So this might mean selling it to advertisers, selling it to companies who can use that data for profit. Whatever it may be, what we're seeing there is that a lot of the apps being offered to students don't guarantee privacy of that student's data, which can be especially dangerous when it comes to mental health apps. So we then asked 100 students in a series of interviews what they'd like to see in their ideal and their like perfect mental health app, what they could have. A lot of them talked about data privacy. As you saw on the slide before, there is not a great landscape of data privacy out there. Students vary on how much data privacy they want, but more or less they agree that they want the app to be transparent. If it's going to take their data, they want to know why. When the pop-up comes asking for access to their photos, they want to know why that's necessary and if they can deny it. Apps that don't explain why they're like saving user data are labeled as sketchy and usually deleted. Students also want a modern user interface. They're used to having things fast. They have an iPhone or a modern Android. When they click on something, they want it to open. If the app is going to take forever, if it's confusing to use, they're going to delete it. They also want credible and useful information. Students know that anybody can make an app. Many of them have probably done it in one of their classes in undergrad. Anybody can put something on the App Store. So when they download an app for their mental health, they want to know it's going to help them, and they want to know there's some foundation behind it, whether it be in research or from the government or from an academic institution. They want to know that it's going to help them. Finally, they also want their apps to be customizable to themselves. Reviews that say this app was really helpful for me mean nothing to an individual who wants the app to be helpful for them. They want to be able to customize it so that they're only doing the activities they need to, that they know are going to help them. So this kind of paints the picture of what a student's like ideal engaging app would look like. And many good apps do exist, but like we saw, the app marketplace is so crowded and it can be difficult to find those good apps, especially when there's very little regulation and students out there are going off of the star rating on the App Store or going off of their college counseling center's website, which, as we saw, might be offering really outdated suggestions.
So as Jenny explained, there's good tools out there. I think some of us have probably found apps that we like, or we've heard reports from students of saying this was very helpful. But there's also a lot of not good ones. We'll just say, for lack of a better word, we're not here to endorse any one app. I'll be clear, we're not here to say any one app is bad or good. It's going to vary based on the needs of each person. But clearly there are apps out there that present risk, right? They're putting students' private information at risk. They're not being transparent with what happens to data. And you may be saying, John and Jenny, how can this be happening? How are these tools existing if they could be potentially causing direct harm today? And how would I kind of help avoid them? How do I separate out those ones that may not be as good and focus on offering the ones that are better? A lot of this comes about because if you think about how do you actually regulate a mental health app? I know it's a strange thing to say, let's regulate a mental health app. We've heard about kind of, we regulate therapy, we regulate medications, but the Food and Drug Administration is trying very hard to regulate this space. But as Jenny said, if these apps are updating constantly, or think of your own phone, how many times an app wants to update. Sometimes it's as frequent as every week. And think about if there's thousands of these apps, they're all updating, new ones are changing. It's very hard for the FDA to keep track of it and to kind of say these ones are doing what they promise and these ones are doing what they don't promise. And in part, what the FDA has said is they don't have the human power to keep up with it all. So they said, well, some of these apps are going to be health and wellness apps. And if it's a health and wellness app, the FDA is really not going to get involved. It would be the equivalent of kind of vitamins if you go to the drugstore, right? They'll put a disclosure to say these statements haven't been evaluated by the FDA. Take vitamin C if you want. If you don't take it, it's up to you. And you don't have to all be policy experts on mental health app regulation. And if this slide looks a little bit confusing, that's the exact right reaction. But to show you kind of how a lot of these apps are kind of not regulated or perhaps making claims that can be confusing, if we start here with a mental health app and we say, what is it? We just don't know. Really what happens is the first question that a software developer has to make is, are they going to call the app software as a medical device? Or sometimes it's called SAMD. So oftentimes the app developer will say, no, it's not a medical device. It's just a wellness app. And when it's a wellness app, again, all those things like HIPAA, privacy protections, different guarantees that all of us kind of work with and know don't really apply, right? It's in that space. And we'll talk about kind of how to tell what a wellness app is, what it isn't. Sometimes it can be very tricky because the website for the app may not reflect that it's a wellness app. You usually have to look into privacy policy and you'll kind of see it says this app makes no medical claims. But where it gets interesting, let's say the app developer says, yes, this is software as a medical device. They get to this new junction point at 2, and the FDA has said, well, there's so many apps that technically could be software as a medical device. They said, we have this concept of enforcement discretion. And for apps that appear to be very low risk, we're just going to not regulate them, or we're going to kind of let them be if they're making mild claims. And the FDA has a list of kind of what makes an app enforcement discretion. Things like mood tracking, doing mindfulness on an app, getting kind of a psychoeducation or tip of the day, getting a reminder to take a medication, generally fall under its enforcement discretion. So you can imagine that most apps are kind of falling under wellness or enforcement discretion. So there's not really active FDA oversight. There's a couple apps that actually become the focus of FDA oversight. And we won't talk about those as much because there's very few of them, and we're really talking about this space. You may see in the news something called Pre-Cert, the Pre-Certification Pilot Program. This is a pilot program by the FDA that aims to kind of have a new way to evaluate apps. It's a pilot program today, so we don't have to know more about it. What's interesting is there's also the federal FTC, the Federal Trade Communication, has some role in app regulation. And this is interesting. If any of you remember Lumosity, the brain training app that used to have a lot of ads on NPR, and you may have noticed those ads have gone away in recent years. The reason was the FTC sued Lumosity for false marketing. It wasn't for medical claims. They said they were making false marketing claims, and that was kind of a trade issue. Recently, there was a fertility app that the FTC sued and settled with about kind of false marketing. So, but for our purposes, we'll realize the FTC has some role in regulating it, that they may sue apps that they feel are doing false marketing of claims. But generally, a lot of the apps that we're seeing in the college space are kind of falling into the self-declared wellness space. and they're falling into the self-declared, into this enforcement discretion. It doesn't mean that if the app says it's a wellness device, it's really doing it, but that's how they're building a legal reason for what they're doing. Oops, there you go. Next slide. So what's interesting is a lot of apps will make claims on the iTunes store. If you go to look at it, if a student says, hey, John, you should look at this app with me, sometimes the claims will be a little bit wild. We probably know that coronavirus does not respond to vital tones and sound. That may be useful to help people relax, but that should not be a cure. So this was a more blatant example that Jenny and I found. But there will be a lot of apps that really just will exaggerate their claims of effectiveness. It's not always maliciously done. Sometimes people building these apps don't have a medical, a counseling, a psychology, a nurse practitioner, or social work background. And they'll make claims that they think are true or hope are true. So it can be difficult to, again, rely always on what the app stores say. Where it can be a little bit tricky, and you have to be careful too, is, again, sometimes mistakes will be made unintentionally that have perhaps more serious consequences. There was this recent paper came out that looked at apps around kind of helping with people's suicide crisis and offering actually incorrect hotlines for suicide prevention. And you say, well, how does that happen? It's imagine hotlines will change numbers, people may put in the wrong number. Again, no one's trying to cause malicious harm here, but it really does kind of bring up the point that you probably want to at least look at these apps once before you put them on a list of apps you're doing. You probably want to check it out yourselves. You want to at least make sure it passes the eyeball test, that it's doing these basic safety things, because the worst thing, right, to be giving people apps that, again, have incorrect information about suicide prevention. And again, it happens. And in this case, these were apps that were, again, collectively downloaded more than 2 million times. So these aren't kind of hypothetical perils of misinformation. They're things that could happen and be realistic. I think sometimes, too, the easiest way, or kind of, I think when Jen and I first looked at the space, is you kind of type into the Apple Store or the Android Google Play Store and you say, well, what is the top app, right? You type in depression, you type in OCD, you type in anxiety, and apps will come up, different ones. It doesn't actually mean that's a good app. It doesn't mean it's a bad app. It really is just more a popularity ranking. And I think just as we've seen that college rankings are not always valid, rankings of doctors on websites are not always valid, just because an app has more stars or shows up higher in a search doesn't make it more valid. This was a search we did a couple weeks ago for the term schizophrenia. It really comes up with a Pong game where you play Pong with your medicine, and it says if you basically lose the Pong game, you lose your mind. Clearly stigmatizing, harmful. It actually freezes when I ran it. That may be my own experience, but point being, we can't really rely on kind of the App Store ranking enough. It's really not going to be helpful in some cases for some illnesses, right? It really may be misleading. It's surprising that this app is kind of put up there. You can see it categorizes itself as an action game, which is a whole different thing we won't talk about. There have been prior papers, this is from 2016, so now 5 years old, really showing that if you look at apps in terms of their star ratings, it doesn't really correlate with clinical utility or usability. They all seem to cluster together. What's interesting too is this fascinating study came out. It was led by Amit Bamwal, who works at Northwell Health in New York, and they took apps that had a high number of downloads, at least 100,000 downloads, or people using them. And they said for these very popular apps, probably brand names that you've heard of, they basically got market research data from people who agreed to kind of let Amit and his team kind of look at their phone. And they said, well, if you download one of these super popular apps around mindfulness or breathing, are you going to be using it tomorrow? And are you going to be using it in 2 days and 3 days? And what they found, you can see, by about 15 days, only 5% of people were still using an app that they had downloaded in these categories on average. So that means if you hand an app to a student and say, here you go, here's a breathing app, you should use it, you're going to be well, I'll see you later. There's a 95% chance, right, they're not going to actually be able to use it for more than 2 weeks. And it's like anything. If we tell people, here's a pair of shoes, go run a marathon, it doesn't mean they're going to run a marathon. We say, here's a gym membership, you're now going to improve your cardiovascular health. It doesn't always work like that. So just because we can give people an app or a link to it doesn't mean they're always going to use it. So I think this is a very important figure to keep in mind, and it really says why college counselors have to have an active role in using mental health apps. It's partially, we'll talk about how to find apps that you may want to recommend and use that fit your needs, but you still have to actively engage with that. And at the end of the talk, we'll talk about how Jenny and I have kind of crafted a service that we use that uses apps, but again, they're part of treatment. We don't just give people apps and say, here you go, this is the app, because we know this is going to happen. We're going to lose people very quickly through non-engagement. And if you're wondering, this trend happens across all of apps. It happens in apps for cardiology. It happens in apps for diabetes. It's not a mental health specific trend where we say where our patients perhaps have lower motivation, or it's something intrinsic to having a mental illness that means you don't want to use or can't use technology. It's anything but. It's just that, again, engagement is hard. And again, I think one of the things we all do in the counseling and behavioral health space is we help people do things that are hard, right? We help people do behavior change. We help kind of keep sustained engagement. So it's important to keep this in mind. Again, even the most popular apps have this issue. I will point out the peer support apps, they did a little bit better, right? The apps that kind of connect people to other people with lived or similar experiences were in some ways actually more engaging. They weren't immune to it, but it tells you something about connecting to people can be a very powerful signal. So in terms of you're saying, well, John and Jenny, how the heck do I sort out this app space? You told me there's good ones, there may be ones I don't want to use, there's things I should avoid. There's a lot of different app evaluation and frameworks and schemes out there. We'll talk about some of the ones we've worked on. The best one to use is the one that's useful for you and your organization. Really what they're all going to do is be a tool to help you make a more informed decision and to bring up relevant points. So we're not here to say any one app evaluation scheme is bad, just like we're not here to say any one app is bad. But one that a central tenet of kind of how we've approached it is having again these static lists or static rating scores is not ideal. We kind of looked at, again, these apps are changing sometimes every week. We've also, again, all seen that we don't rate a medication as the A+ medicine. We don't also say CBT is, the A- therapy and DBT is the B+ therapy. It doesn't really make sense. And it doesn't really make sense to do it for an app either. We also know that different people at different times will respond to different treatments or the same treatment differently. So again, thinking of apps as kind of just always a static list that you give. In some ways, it's an easier way to have that list, but it's really not kind of taking full potential or kind of understanding how these apps could be helping or hurting people. So we built a framework with the American Psychiatric Association that we'll talk about. There's actually nothing specific to psychiatry per se. We actually have an update coming out where we had peer support specialists, we had social workers, we had nurse practitioners, we had psychologists, we had psychiatrists, we had actually students as part of it. But I think, so I'll call it the American Psychiatric Framework, but you'll see how it's a pretty broad general framework that has applicability. And really what it says is you're approaching an app, again, of course the app has to run and work on the person's phone, but it really says, does the app protect data? And if so, the next thing we want to look at, is it evidence-based? If you really think this is just risk and benefit, right? For anything we would do making a clinical judgment, we would say, what are some of the risks and what is the benefit? And then we would say, is it engaging and easy to use for the person at hand, right? So is it kind of tolerable? So we have risk, benefit, tolerability. And then is it going to facilitate care delivery? Are you telling me to track steps just for the sake of it and it really makes no difference? Or is it, we're going to use that to kind of understand as part of my care? So there's nothing secret here. This is really kind of clinical decision making, perhaps for apps in the 21st century. What is the risk benefit? What is the tolerability? And will it kind of have a potential impact and be part of the care plan? So I think no matter what background you're approaching it with, hopefully you'll agree with Jenny and I that these are kind of reasonable features to be looking for an app and selecting them. So what we have online with the American Psychiatric Association, you can actually Google it. We have a lot of videos and information about it. We kind of have these different levels, right, of privacy and security, clinical foundation, engagement, and therapeutic goal. And they also map onto ethical principles. And in each of these buckets, we have some specific questions to kind of prompt you to say, does this app meet these thresholds? And the idea is, again, you don't have to answer every question about every single app, but it's to really prompt you to say, well, what do I know about the security and privacy? And the idea is, if you can't find all the information quickly, maybe that's not the right app to do. The reason we kind of put it in this pyramid hierarchy was to be a visual reminder that we really going to want to look at risk-benefit first. Then we want to look at engagement and then therapeutic style. Some of these apps are really slick and they look beautiful, right? They have beautiful engagement. Sometimes we look at that first. But again, the goal is to say, well, let's actually kind of think about what is the risk benefit first and then move up here. And the framework, again, I think it works well. There's a lot of questions. Again, the point is you don't have to answer all of them. It's certainly not necessary. And why I think we like that and how we've adapted it, though, is people said, well, it takes a little bit of time to do this for every app, for every student. And we know, again, that things like ease of use are going to be personal to different people, right? What Jenny and I think are easy to use may be very different than what someone else thinks is easy to use. So it's really tricky. We don't want to kind of impose our values, our judgment on what it is. But we also realize, again, people want to have some information that makes this a little bit faster and a little bit easier. So how do we take something like ease of use and turn that into something that it could be more objective and replicable? It's clearly not going to be a score because, again, that just doesn't make sense to be easy to use for other people. So what we did is we actually kind of took that APA pyramid model and we expanded it out into about 105 questions. We took ease of use and made that engagement style. We'll talk about what we mean by that. And we took privacy and security and kind of broke that out into questions like, does it have a privacy policy? Does it share data? Does it let you delete data? So the reason we made so many questions wasn't that we wanted it to be complex and you don't have to go through all of them, but we really wanted to say, how can we try to kind of take this theoretical model and make it that's something that's replicable, that's yes, no. And the point of it being, we can then take two different people, and we know that different people have different preferences, right? Someone may be looking for an app that's very evidence-based and that kind of could be free to use. And someone else may care about transferring data. So the point is, if we can have this pool of objective questions that we can all agree on, kind of, we can say the app does have evidence, the app does have this feature, the app does have these data features. What we can do is different people can bring their interests or needs and say, I want an app that has this, and someone else can say, I want apps that have this, and really then kind of figure out what matters for them. So the goal isn't to say one app is better. We're not saying one cluster of these features makes an app good, makes an app bad. Someone may say, I want an app that's not private. I don't care. I'm a very public person. I post everything on Facebook. It makes no difference to me to privacy. So I'll let Jenny explain what the database looks like and how you can kind of realize this idea in today by going actually to that website you can see up there.
So yes, this is the app database where basically any app within this database has been rated on those 105 questions. That means an individual has actually downloaded the app, gone through each question, answered yes or no. And you can just see a little preview here. If you were on the real website, you could scroll all the way to the left or all the way to the right and see all of these dots filled in for each question. And I encourage you, if you're interested, to go right now to apps.digitalpsych.org. But how it works is that a user can click on any of these filters on the left side and decide what they want. For example, for cost, maybe they want an app that's completely free. Maybe they're willing to pay if it's of higher quality. They can go down the list and choose each thing they want. Oops. Once they've selected all their filters, the database returns all the apps available to them. From there, you can scroll through and see how they compare to each other. You can click on each one and see a description. And this database is maintained and updated by volunteers. So each volunteer would go through kind of a training on how to rate apps, how to, be objective when you're answering all these questions. And that kind of maintains this database so that even when apps get updated by the developer, these questions will be answered again by a rater to make sure we have the most, up-to-date analysis of what each app does and what it offers. So I figured it would be a good time to kind of try an example of finding a perfect app. So I encourage you guys to go to apps.digitalpsych.org now, and we have a sample student who's looking for an app. And I would say try to find the filters that best suit them, but essentially this is a college student looking for a mental health app. They want to have a journal feature to write down their thoughts and feelings. They're not willing to pay for the app, but they would like it to have some foundation in research. They're wary of their data being shared and would like some privacy guarantees, and they have an iPhone. So feel free to write in the chat if you think you identify like a good app, or what filters you would choose for this person. But where's the chat?
We'll let you take a look at it for a second.
Yes, I'll let you explore it on your own while we try to find the chat.
And I think the point of this case too is, again, this is how, we're not saying there's any one great app for this or not. The idea is by talking to a student, you understand their preferences, their needs, their values. And again, that takes the clinical work, whereas to collect that information. A database is just a way to kind of ping and say what exists that kind of meets the clinical needs and values of the person at hand. And it's going to differ, right, for different people. This is a case, again, that we made up fictionally, and we'll show you kind of the filters we used and the apps that we brought back. And because, again, apps will kind of meet the search or not, doesn't mean those are good apps or bad apps, but again, I think it helps at least say, here's apps that kind of are at least offering features that the person may want to use. So again, there's no endorsement implied of any app either way. So I think we found a chat again. So we're seeing some questions of, so it looks like people are still looking for it. And maybe we'll show you what the solution would look like on the next slide, or how you could do it. And then I think it'll make a little bit more sense.
So when I searched for an app for this student, the filters that I chose were an app that is totally free, has a privacy policy, and within that privacy policy declares data use and purpose. So at least the student's gonna, when they download an app, have the opportunity to see how their data is being used so they can decide for themselves if they're comfortable with that or if they're not. A feature they wanted was journaling, and they also wanted some foundation in research. So I also clicked on the filter that included supporting studies. What this has done is taken us from a list of hundreds of apps and narrowed it down to 6. From here, we can scroll through and see like which of these are going to work for this student. They never mentioned, what kind of source this app should come from. So we can see, okay, like a lot of these apps seem to be coming from for-profit companies. Would we feel more comfortable with a nonprofit developer or a government developer, and go from there? So one more example that's a little bit different, but in this one, we're looking for a CBT app for a student who's willing to pay if it's of good quality, but specifies that they want it from a nonprofit company or the government, and they want to be able to do self-assessments and delete their own data from the app. And for the sake of time, I'm going to show what filters we found for this, but essentially here we were able to narrow down to 5 apps within the database, and we marked that they would want assessments and screenings. They want to be able to delete their own data. They would like a CBT-oriented app from the government. So here they can compare all the results. And as you can see, because we selected government, the only things we're going to get are in government. These filters will exclude everything else, but at least this gets them an idea of where to start looking in their app. They can click on each one, read the description, and go from there. But this is how the app database works in general. It's also searchable by name of app. So say you're familiar with an app, but you want to know how it rates on this, you want to know a little more about its privacy protections without reading through their whole privacy policy, you can actually search the name of the mental health app and see which boxes are checked and get kind of a good idea of what their privacy policy would look like.
So you can see there's a lot of options what you can do with this. There's a lot of filters to kind of meet different demands of people. As Jenny showed, we're not making a judgment. We're just saying, what are the features you want? And let's kind of return what apps do it. Perhaps you could tell a student, well, there's 5 apps. Do you want to kind of be a little bit more picky, or what else do you want to do? There's many cases where you'll say, I want a completely free app that's very private, that's very evidence-based, and does X, Y, and Z. Nothing may come back. That means 2 things. One, that just doesn't exist, or we haven't included it in the database yet. If there's apps that you find that we haven't included, we're always happy to add them if you email us. We try to keep this, again, up to date and we're close to 300 mental health apps now, but we realize there's new ones coming out. There's always exciting ones. So if you see something, do let us know. We like to keep this alive and moving. So I'm gonna click next. So I'll give you a quick example. We'll conclude and leave time for questions of how we actually use apps in our care with the student population. So like we're doing telehealth visits right now, but what's interesting is after each visit, we work with a student and we say, if appropriate, do we want to use the smartphone to kind of help capture information, say PHQ-9 scores about mood, anxiety scores. And we may or may not kind of say for each person, we want to kind of capture some information from the phone. And we may also kind of recommend an app intervention to kind of help them practice a skill that we've taught them in the session, or we may not. And to keep up engagement, as we talked about, engagement can be really tricky. We have a new team member called the Digital Navigator who kind of helps provide non-clinical support, but kind of technical support, encouragement, motivation to keep using the app. So what that makes our telehealth visits very interesting because the app is, again, bringing in new data about, say, scores that people have. We can look at anxiety. It also means people are practicing skills outside of the session and hopefully, again, moving more quickly on the path to recovery. And to kind of putting this app part together, again, so the clinic that we built kind of use psychiatrists and social work, our mental health professionals. We're using data for MindLamp, which is an app that we haven't talked about that Jenny and I have developed. It's free, but we don't put it on the database for conflict of interest. It's actually open source software to gain better insight into people's experience between sessions and help them kind of customize treatment around what they want. So I think this was in the Wall Street Journal in November of this year, but it's not, again, we're happy to meet with people outside or kind of show you how you can integrate apps into care. Once you kind of have apps that you like, or you kind of use a tool like Jenny showed you, this Mind database we built, you can have a small library of apps and you really use them to kind of enrich care and supplement. And so far the response that we have got has been very positive. It's actually been in part so positive that we're working to streamline it and make kind of our app, our kind of hybrid care flexible. What we kind of landed on was something called technology-enabled clinical care. And the idea is we have this kind of 8 sessions of care that people would go through. And each session kind of talks about things that we all know: shared decision-making, understanding thought patterns, identifying coping skills, cognitive diffusion. And each session kind of has a exercise that someone can practice on the app. So the clinical session is customized to someone's needs, but there's kind of direct app practice that people can do to kind of really master the skill. And when they leave the 8 sessions, they get to take the app with them, right? The app is free, it's on your phone, to at least have it with them, which again, I think is a nice, interesting way to kind of integrate apps into care today. I'll also say just it's interesting, large health systems are starting to integrate apps. This was a report from New England Journal of Medicine that came out in January this year looking at Kaiser Permanente, which is a large, often West Coast healthcare provider, but they're around the country. And you can see that they're actually kind of, for some people, recommending apps as kind of part of their treatment in mental health. And this number they published, I thought, was very interesting. In January of 2020, so right again before COVID, they actually were making basically nearly 21,000 referrals to apps. Once COVID kind of pandemic was at its height, they were giving 44,000 referrals to apps. And they actually built a small toolkit. And you say, well, how did they build a small toolkit of apps? Clearly, they use many processes, but one was this APA framework we talked about, that pyramid. And again, what you guys have learned is we've now made hopefully that pyramid in some ways even more accessible through the database. So Kaiser is able to use it to kind of, again, they did many more things than just the APA pyramid, but to really make it something that's part of care, that they're really doing more. And I wonder, again, nearly 12 months later, what is this number of apps that they're kind of referring people to? It's likely even higher. So say thank you. This is our group's website and a good way to reach out and contact us.
Thank you both, Dr. Torous and Jennifer. What an excellent presentation. And wow, I thought I knew about digital apps and smartphone technology, but again, what great information you brought. I want to thank you both for an excellent presentation today. There's been a number of comments I can see inside of the both chat and Q&A about the presentation today. Thank you all again for your time and have a wonderful day. Goodbye.